In this video, we'll be discussing episiotomy healing tips. What is episiotomy? Episiotomy is when your midwife or doctor makes a small cut in your perineum. Your perineum is an area between your vagina and your anus. You will understand it better in this diagram. It prevents you from tearing or to speed things up if your baby needs to be delivered quickly. A local anesthetic is used to numb the area to stop you feeling any pain. While episiotomy is no longer a routine, that said, sometimes there are situations in which episiotomy is necessary. Remember, every woman reacts differently in labor, so the following factors could make you more prone to an episiotomy. 1. If this is the first baby you've had vaginally. 2. If the pushing stage of your labor goes on far longer than necessary. 3. If your baby is born with the help of forceps or ventouse or vacuum delivery. 4. If you've had tearing before.
4 kg.
5. If your baby weighs more than 5 kg. Now, let's go to episiotomy healing tips. Number 1. Take time to rest. Rest is very important for your recovery. It is a good way to recover after delivery and heal your wound. Avoid strenuous work as you recover. Ask for help from your relatives and friends as much as you need it. You know, in our African setting, especially in Nigeria, this is when mothers or mother-in-laws come to do omugo. So use their help. It's very important. Take a warm, clean bath at least 24 hours after delivery. Do 6 baths with warm water, not hot water, to avoid more damage to the area. Choose cooling medicated pads, medicated for hemorrhoid use. Find a product that is hypoallergenic, pH balanced, and perfume free. Get numbing sprays specifically made for new mothers. Talk to your healthcare provider about the use of stool softeners and laxative. You know, it can be very painful when you want to poo. So take plenty of fluid. Use antibacterial sanitizers on your hands before cleaning the perineal area. This helps prevent you from infecting the wounds with your hands. Use baby wipes instead of toilet paper to prevent friction while you wipe. If you have problem keeping your perineum dry, use a blow dryer set on low and hold it at least 8 inches away from your skin. Wipe from front to back. Drink plenty of fluids. You can take a normal diet, but drink plenty of fluids. Wipe from front to back. Why do you do this? Well, if you know, let me know in the comment section below. If you are enjoying this video, please give me a thumbs up. If you are sitting, sit gently or sit in a donut-shaped cushion. You agree with me? Episiotomy can be very painful. I experienced this when I gave birth to my first child. It wasn't easy. This can help you feel more comfortable. Ways to cope with pain with episiotomy. Use ice pack immediately after birth. Remember, do not place the ice pack directly on the skin. Wrap it with a towel or cloth on the affected area. Some people say having a warm bath helps you relax and ease the pain. Different folks with different strokes. Pour warm water, not hot water, over your vagina and your perineum area to help ease the pain. And always wipe from front to back to keep your stitches clean. To relieve the pressure on your wound, put a clean pad and press it lightly on your perineum area while you pull. Press it lightly against your stitches in your perineum. You can also do seize bath. You get a clean bowl with warm water, not hot water. Sit on it for 2 to 3 times a day. Remember to stay hydrated and eat healthy to help relieve or avoid constipation. Constipation with episiotomy is not a good experience. You can talk to your healthcare provider on the use of laxatives for constipation. Painkillers may also help to relieve the pain. Paracetamol is safe to use even when you are breastfeeding. Ibuprofen is also safe to use when you are breastfeeding, but make sure that your baby is not premature, born before 37 weeks of pregnancy, or was a low birth weight and has any medical condition. Aspirin is not recommended if you are breastfeeding because it can pass to your baby through your breast milk. Other ways to help you recover from episiotomy: restart your pelvic floor exercises as soon as you can after birth. They enhance blood circulation and aid the healing process. It will also help reduce pressure on the core. Pelvic floor exercise involves squeezing the muscles around your vagina and your anus, like you are trying to stop yourself from going to the loo. What other exercise do you carry out to tighten your pelvic floor muscles? If you know, please put them in the comment section below. I'd like to hear from you. Don't forget to give me a thumbs up if you're enjoying my video. Some women say it can help to talk about your birth experience with some close family members or friends. If you are worried that you aren't healing very well, talk to your midwife or your healthcare provider. Normally, an episiotomy wound is supposed to heal within 2 weeks or at most a month. So if you feel you're not healing properly, please talk to your healthcare provider. And if you see these following signs, see your healthcare provider immediately. Red, swollen skin around the wound, persistent pain, or a smell that isn't usual for you, pus or liquid coming from the cut. Tell your midwife or your healthcare provider immediately as soon as you can so that they can treat you for infection. If you've had scar tissue and it's causing you problems, talk to your healthcare provider. Thank you very much for watching. See you in my next video. Please drop your comments, your questions and suggestions in the description box below. Thank you.